Welcome to The Explainer. Today we're diving deep into one of the most important processes for veterans, how the VA actually rates mental health conditions. We're going to look at the official rulebook to see exactly how a diagnosis turns into a disability percentage.
But hold on, before we even start talking about percentages, we have to cover the bedrock of any disability claim. It's called service connection, and without it, a claim doesn't even get off the ground.
So how does the VA make that link between your time in the service and your current condition? Well, it's not a guess. They're looking for three very specific things to connect the dots.
It's really a three-step process. First, you have to have a current medically diagnosed condition. Simple enough. Second, something had to have happened while you were in uniform. An injury, an event, you name it. And third, and this is the key, a medical professional has to connect those first two pieces. That link is called the nexus. You need all three, or the claim stops right there.
Okay, so with that foundation laid, let's get to the heart of today's explainer, the actual rating formula. This is what the VA uses for mental health conditions like PTSD, anxiety, and depression, and it comes straight from the Code of Federal Regulations.
Here it is. This is a snapshot of the general rating formula for mental disorders. Now look closely. Notice how every single percentage is tied directly to something called occupational and social impairment. It's not about the diagnosis, it's about how much that condition impacts your ability to work and live your life. The higher the percentage, the more severe that impact is. So let's break down what these levels actually look like. A 100% rating, well, this is reserved for the most severe cases. We're talking about a total inability to function, both at work and socially. The symptoms you see here, persistent delusions, being a danger to yourself or others, these paint a picture of a condition that's just all-encompassing and requires constant care.
Now, when we drop down to 70%, we're still looking at a really high level of impairment. The VA sees this as having deficiencies in most areas of your life: work, family, even your own judgment. That phrase, inability to establish and maintain effective relationships, that's huge. It shows just how deeply the condition can affect every part of a person's life.
At the 50% mark, things start to get more specific. The criteria begin to quantify the symptoms, right? We see things like panic attacks more than once a week. It's not just that you have them, it's how often. This level paints a clear picture of a veteran whose ability to reliably hold down a job or interact with others is significantly impacted.
And then at 30%, the impairment is often less constant. The key word here is occasional decrease in work efficiency. Symptoms like chronic sleep problems or mild memory loss are absolutely serious, but they might allow for periods where you're functioning okay, just with these intermittent struggles.
Okay, I know, these descriptions can still feel a little abstract. So, the best way to really wrap our heads around this is to walk through a hypothetical scenario. Let's see how a VA rater would actually apply these rules to a real person. So, let's meet Alex. Now, Alex has already established service connection and has a diagnosis. The VA's job is to figure out the right rating. Alex's medical records clearly show these symptoms, but remember, the diagnosis isn't what gets the rating, it's the level of impairment caused by the symptoms.
And this is the crucial evidence. It's not just that Alex has panic attacks, it's how those attacks, that irritability, and the memory issues are actually affecting Alex's life. That negative performance review, that's a perfect, documented example of occupational impairment. The trouble with friendships? Clear social impairment.
So, let's put it all together. On the left, you see Alex's documented problems. On the right, you have the official criteria for a 50% rating. Just look at that. It's an almost one-to-one match. Panic attacks more than once a week, difficulty with relationships, reduced productivity. The evidence in Alex's file is a mirror image of the regulation.
So, because of that crystal clear alignment, the VA rating agency assigns Alex a 50% disability rating. And that, in a nutshell, is how the process is designed to work, from start to finish.
The big lesson from Alex's story, and from any claim really, is the need to prove what the VA calls functional loss. This idea is so fundamental, it has its own entire section in the regulations.
And this right here? This quote perfectly sums up the entire philosophy of the VA rating system. It's not about the diagnosis they give you. It's about how that diagnosis gets in the way of you living your life, holding a job, and just functioning day to day. Everything is built on this idea. This is exactly why your compensation and pension exam, the C&P exam, is so incredibly critical. The rules put the responsibility right on the examiner to document how your symptoms mess with your life. And that means you have to be able to clearly explain that functional loss when you're in that room. It's absolutely essential.
But let's be honest, cases aren't always as clean and clear-cut as Alex's scenario, are they? What happens when the evidence is a little fuzzy? What if it could point to a 30% rating or a 50% rating? Well, the VA has a very specific, binding rule for that exact situation.
This principle is known as the resolution of reasonable doubt. And what it does is it acknowledges that sometimes the evidence isn't perfectly black and white. A rating specialist might look at everything and still be left with genuine uncertainty about which rating is the right one.
Now listen to this, because it's one of the most powerful pro-veteran regulations in the entire system. I'm going to repeat it. When there is a reasonable doubt about how severe your condition is, that doubt must be resolved in your favor. It means if the evidence is tied, if it could reasonably support two different ratings, the VA is required by law to give you the higher one.
So, the key takeaway from all of this is that the VA rating system is built to measure impact, not just to label symptoms. And knowing that, think about it. How might that change the way you talk about your own condition? Understanding this framework is truly the first and most important step. Thanks for joining this explainer.